All right, so good morning, everyone. Like I said, my name is Shira with HR, and we have our United Healthcare rep here, Gina, who's going to go into a little bit of detail about our wellness programs that we have through United. The first one is going to be Motion. This is the program where you can actually walk to earn money into your HRA or your HSA so that you can use that money for your medical expenses. And then also she's going to go over United Healthcare, the app. So the My UHC app, as well as the online website, and then she's also going to go over Rally. So I'm going to go ahead and hand it off to Dina. If you can't hear me or if you have any questions, again, the chat is open, so please feel free to put any questions that you have in the chat, and then at the end of the call, we'll open it up for questions.
Hi, everyone. Thank you so much for having me. So I'm going to talk a little bit about Motion. So this should be pretty exciting because I'm sure you all made your medical elections, so now you know what plan you're going to be on, and this will give you a little bit about information about how Motion will work, how the devices will work, a little bit about what the website will look like. So I first want to start with saying that probably within the next week, you'll be receiving an email. In that email, it's going to be asking you to register. So that email will be coming to your work email address. Once you get that email to register, it's going to walk you through a step-by-step process on how to create your account, how to order your device, how to set everything up. That way, effective January 1st, you can hit the ground running and start walking. Okay, next slide. So this explains just a little bit about what we'll be going over, your Motion goals, how much money you can earn, the $55 credit that you'll get, which I'll discuss, and basically how Motion helps to reduce your medical expenses. So the first slide we're going to go to next is, hold on one second. Hold on. Okay, you can skip this, so it's kind of a little redundant about. Okay, perfect. So this is going to be your fit goals for the HSA plan. So the HSA plan, you are eligible to earn $1,095 for the year for you, and then $1,095 for your spouse, as long as they're enrolled as well. These are the goals that set out for you to achieve daily. So once you achieve the goals, the really cool thing is you can track all of this information right on the device or using the website or the app. So if you're ever curious about where you are in achieving those goals or how far you've come throughout that day or what you're looking at, you can be able to use the website or the app to always keep a constant look at it. What's really cool about the actual device is the device will register and jingle and light up and do all kinds of fun stuff every time you achieve one of those goals. So like this weekend I was at Disney and I was, walking everywhere, and every time I reached that goal, it was like, 3 out of 6, 3 out of 7. It would always tell me every time I met it. And then once I reached that 6th, for like the fit goal, once I reached the F for frequency, the 6th time, it buzzed and jingled and, made sure that I knew that I had achieved basically the fit goal for the day. So that was awesome. And it keeps you really excited and motivated. So you always kind of have an idea of where you're at and where you're going. So by the end of the day, when I was ending at 19,000 steps, I was like, done, cha-ching, I knew I had did it. So kind of this is how it works for the HSA plan. Now the HRA plan will be on the next slide, and the goals are exactly the same. It's just the payouts are a little bit different for the HRA. So you're eligible to earn $1,460 for you, and then $1,460 for your enrolled spouse on the HRA plan. Otherwise, it functions exactly the same in the amount of steps or the frequency, intensity, and tenacity that you have to meet. They're exactly the same. It's just the payout dollar amount is different. And then again, it's two differences on how it gets paid out. So we'd like to remind everybody that the money you're going to be earning starting January 1st will be paid out quarterly. So you will not see that first payment until April. So it's just a reminder. So the next slide we have is talking about the devices. So these are all the devices that are able to be used on this program. So when you first sign up and you get that email and you register, it's going to talk about a $55 credit. That credit can be applied for any of these devices. So what it kind of wants you to do in the first scenario is the $55 will cover completely in full the cost of the Fitbit HR or the Garmin 4. That will pay for it completely. So once you register, if you want one of those two devices, you click that box, It costs $55. You close that section. It'll be mailed to you, shipped to your home or whatever address you list, and easy peasy, that's all you need. Now, if you happen to have your own device, it has to be one of these devices that are listed on this screen for it to be compatible. Any other device that you have will not be compatible at this time. So keep in mind that as long as you have a device on this list that works, if you're bringing your own, you absolutely can do so. When it comes to the section on the website that's asking you about devices, you just check the box that says bringing my own, and instead they'll take that $55 and they'll apply it toward your account, meaning that that will be your first deposit into either your HSA or your HRA account. So you'll earn that money versus using it to spend on a device. The next option you have is, let's say you don't want to use your own device, you want a new device, but you don't want the baseline device, which is that Fitbit HR or the Garmin 4. Let's say you wanted something like the Samsung Gear. So what you could do right there on the app, on the website, is you take that $55 and you apply it towards the cost of that device, let's say that Samsung Gear device. So you apply the $55, and whatever is the difference, you will owe right there at checkout. So you'll have to pay the difference right there. You can load your debit card, your credit card, whatever you want right there, and you pay for that device at checkout. And the $55 credit applies to that, and then you move on. Your next step is, let's say you wanted the Apple Watch. Okay, so we have the Apple Watch. We have the series that you can get. Now, keep in mind with the Apple Watch, this is the only device that we have where you have the option to actually walk off the cost of the watch. So if you want the Apple Watch, you will apply that $55 credit to bring the cost down, and then you will sign up for the Walk It Off program. The Walk It Off program gives you 6 months to pay off the cost of the watch. So any money you earn from January 1st on will go to pay off the cost of the watch first, versus going into these accounts for you to use towards your medical expenses. So after the 6 months, if you have not paid off the watch, they will charge the credit card you have listed on file. That's how that works. So you might end up at the end of the 6 months having walked off the complete cost of the watch, or walking off just a portion of it, and then if you walk off only a portion of it, they'll just charge you the difference to that credit card on file. But again, you will be able to look at on the website all of the times you're walking, how much you're earning, so it'll never be a surprise for you to know how much you've earned by walking. Okay, so those are your device options. There shouldn't be any real confusion when you actually log on and register for the first time. It'll walk you through step by step the process of loading your device and all the options you have. You know, the color options, if you wanted a specific Apple Watch that happens to be the smaller size or the bigger size, all of that information is listed on there. So it'll walk you through that whole process. This is kind of about the devices. Okay, next slide. So this is what the experience for you guys are going to be like. You're going to get that email soon that's going to ask you to register. It's going to be coming to your work email. Now, that's for you and your covered spouse to participate in the plan, not for any dependent children. So it's just you and your spouse, but you both have to be enrolled in United. And then once you register, you'll take you through the process of selecting your tracker, and then it'll take you through the process of setting up your tracker. So once that device does arrive, that's when it'll walk you through, okay, your device has arrived. Here's how you load it. Here's how you link it to the app. Here's how you then link it to your phone so the watch and the phone communicate. So it walks you through that whole process for you. And then it gives you a little bit of example of what your dashboard will look like, so you can follow your process, your progress about how you're walking, how much movement you're making, all of that. So besides that, you also have the motion team that's available to you. It's an 800 number. It'll be different than the 800 number that you call for like your regular medical questions if you ever needed those questions. This is a team that's set up strictly for motion. And the nice part is they're available for you for any kind of technical support you need, or for some reason if your watch, let's say, isn't syncing and you know that you had a big weekend of walking and you know one day you absolutely met those goals, but for some reason the data isn't showing up on your report, that's completely fine. All you do is you call that motion hotline, you talk to the representative, and they'll go ahead and they'll give you the credit for that day. So just know that that option is available there to you. We really want to make sure that the members are engaged and that, you know, you're getting credit for what you do utilize. Okay, next slide. So this is going to give you just a little bit of an example of what you're going to go through when you first get that motion email. You're going to go ahead and sign up, then you're going to enter your profile details, you're going to create your login, create your account. It's all kind of be set up for you on a step-by-step process. So it should be pretty easy to utilize and pretty easy to understand. We want to make sure that the process is simple and everyone gets excited about it. Okay, next slide. Okay, so this is going to be a sample of what your dashboard is going to look like. So it'll have for you like the date, it'll show you the last time that your watch synced, it'll give you an idea of how many goals you've met, where you are at in your steps for the day. So it's really nice, so at any time you're able to go on there and always kind of take a look at where you're at. If for some reason like you're curious about it, or you like to, you know, end your evening knowing, hey, this is where I'm at. The nice part also is at the end of the week, they always send you an email that basically says your week in a nutshell, and they'll break down how many times that week you met this goal, how many times that week you met that goal. So you should always be in constant knowledge of where you are with obtaining your goals, so where you are thus then for your dollar amounts. Okay. And this is going to be another sample report you can run. So you're able to run your own member level reporting. So this kind of give you, let's say, the month of April. You can look and see how many days in that month from all the days that are listed on the bottom that you achieve those certain goals. Again, and then it shows you at the bottom the total money you had earned that month. Next one. Okay, so that kind of opens up the question and answer section for motion. I don't know if you want to do it now or you want to wait to the end.
We can wait. I'll go ahead and open the lines up. If you have any questions, please feel free to ask them. Give me 1 second. All right, so everyone should be unmuted now. If you have any questions at this time about motion, please feel free. You can ask the question over the phone, or you can ask it in the chat. So someone asked a question about registering their spouse.
Mm-hmm.
Do we register our spouse separately?
Yes, you'll register your spouse at the same time you're registering your spouse. All the information has been loaded into the motion system, so it has every name and social security number already pre-populated in a back system, so that way we ensure that only the eligible spouses are being correctly enrolled. So as long as your spouse is enrolled on your medical plan, you should not have a problem registering them at the same time that you're registering yourself. It'll all be done through your portal.
Do we have any other questions?
Hey, good morning. It's Arjuna.
Hi.
Hey, question on the devices. I own 2 separate devices, and I don't believe they're actually eligible, but I just want to make sure. I have the old-fashioned Fitbit HRs. Is that not a device that's good for this program?
If it wasn't on that list, most likely it's not going to be. A lot of old generation devices are not compatible. So I know that the new Fitbit Charge HR is. Let me see if we can pull back the slide device. Hold on 1 second. Perfect. Okay, so if you do not see it listed here as a Fitbit Charge 2 or a Fitbit Charge 3, then no, it would not be compatible.
Okay. And neither, they're confused with the Samsung. Okay, it's just a Samsung Gear, not the Samsung Active. Okay.
Correct.
And that's it. Thank you.
Oh, sure, no problem.
We had another question come through the chat. It says, Are spouses required to participate?
No, this is completely optional. Also, you as an employee are also not required to participate. It's a completely optional program if you wanted to. I always like to say it's free money on a table, so why not, you know, especially with the baseline device being given to you for free. Basically, it's $55 for the device. That's how much we're giving to you as a credit to incentivize you to use the program. So why not take advantage of it? You know, slap a watch on your spouse and send them out there. And if they meet some of the goals, great, who knows? But no, it's not mandatory that you or the spouse have to participate, either one of you, completely optional. One of you can, both of you can, but at least you, the employee, has to for the spouse to be option.
All right, and we have one other question. It says, on the HSA account, they saw that there are 3 separate ways to earn money, which is up to $3 a day total. Can they do all 3?
Absolutely. The goal is to do all 3. So the question was, do you have to complete all the FIT goals? The goal is for you to achieve all 3 of them. You could just complete 1 of them or 2 of them or none of them. But yeah, the goal is absolutely try to complete all 3. That's really where we want you to be. That's how you're going to earn the most amount of money, is to achieve all 3 at the end of each day.
All right, do we have any other questions? All right, if we do not have any other questions, we're going to go ahead and Dina's going to go into more detail about MyUHC as well as our rally program. So I'm going to mute the lines again. If you have any questions or any issues viewing the slides, just please let me know, put it in the chat, and again, we'll open the line after this PowerPoint for questions about rally.
Okay, so myuhc.com is going to be your portal to all your information. You guys should have already started to receive your ID cards in the mail. Those ID cards are going to have your member ID number on them, and that's what you're going to need to utilize to enroll or actually register for this program. If you have not received your ID card, you want to get in touch with HR so we can kind of try to track down where it is. Keep in mind that they are going to come in plain white envelopes, so the likelihood of it being thrown out with all of the other junk mail that's coming this time of year could be high. So if for any reason you haven't received your ID card yet, make sure that you let HR know so we can just verify we have the correct address on file and then get a new one ordered for you. Okay, next slide. So this is kind of what myuhc.com is going to look like. So myuhc.com is going to be, again, access to all your information. Once you register, it'll map to you. So every time you log in, it'll have running totals of your deductible, of your out-of-pocket maximum. It'll have access to all your explanation of benefits. It'll have access to your personal information if you're looking to find a doctor. It'll already have your network loaded. It'll have your correct formulary list, so your prescription drug list loaded. So if you go in to price out a drug, you'll be actually looking at the correct information on that. So all this information is built for you. It's at your fingertips whenever you need it. So this is what you're going to need to register in first. You have to register on myuhc.com first before you can then start utilizing the app, which we'll get into in a minute. So myuhc.com is the first step you need to make. Okay. So the next slide just, again, gives you a little bit of idea of all the things you can do on there. Price out cost of care. It'll also have all of your Optum banking information loaded. All of that information is going to be in there for you to be able to look at and access at real time. So you can go in anytime and it should have up-to-date information, which is awesome. Okay, next slide. Again, a little bit about how your personalized dashboard will look. A little bit about your running totals, how your recent claims will pop up, so you can really keep an eye on everything and where the money is being allocated. Next slide is finding doctors and care. So you can look up here. Again, it'll have all of your information already loaded. The nice part is if you guys are ever, let's say, out of the state and you get sick and you wanted to find a doctor, all you have to do is put in the zip code of where you're at, and it'll already be linked to your network, and it'll pull up doctors around where you're located at to help you find access of care. So just know that you have that available to you 24/7 on the website. This kind of shows you again how it looks to find doctors. It'll give you a little bit of information about the doctor, their ratings. United rates our doctors based off of quality of care and efficiency of treating patients, and that's where they earn those hearts. So if you ever are curious about a doctor, they've gone through a strict vetting process with United. If they have those 2 hearts, they're one of what we called basically a premium provider for United. Go ahead. Okay. Again, this kind of just gives you the breakdown of the quality of care and the stars, and then you can also read reviews that other members have written about the doctors. Okay. This will give you an idea if you ever wanted to price out a specific topic that you needed to be helped with, or a surgery you're going to have coming up. It'll give you what your estimated cost would be for all the costs associated with that particular incident that you've put in. Okay, the Health for Me app, you can go to the next slide, is basically just a mini version of My UHC. The nice part is it also has a copy of your ID card on there. So you'll be able to, if you're ever at the doctor's office and you forget your ID card, you'll be able to pull up your ID card right on the app. But otherwise than that, it's the exact same thing as My UHC. You can price out care, look for a prescription cost, look for a place that you needed to go, let's say have an x-ray. All of that can be done from the app. So it's easy and convenient to use. Okay, and this is what the app looks like in either your Droid store or the Apple, what the app is. Again, have to register on myuhc.com first. Okay, so Rally is going to be your health and wellness portal that you're going to utilize, your platform that you're going to utilize. After you register on myUHC, halfway down the page, you're going to start seeing stuff come up about taking your Rally Health and Wellness Survey, your health assessment. Go ahead to the next slide. It's going to say, get your Rally age, build better habits, set smart goals. It's really just trying to get you to participate in getting a baseline of where you're at with your wellness. Go ahead and click the next one. This is what the Rally is going to look like via the website or your app. So after you go ahead and register on the website, that's when you can put the app on your phone. So it's just kind of showing you that everything you're going to do on the website, you can also do on the app. This is kind of the setup of Rally. So Rally is going to get you to take your health wellness assessment first. Takes about 10-15 minutes. It's very interactive, very easy to use. Going to ask you all kinds of questions about how you're eating, how you're sleeping, things you're stressed about. It'll then start asking you questions about what's my A1C and when's the last time you had it checked? What's your cholesterol? When's the last time you had that checked? Kind of just letting you know that those are answers that you should know. You get preventative care covered at 100%, so there's no reason to not be going and getting your physical done with those blood tests associated with it, so you have answers to those questions. But besides that, just kind of gives you an overall look at where it assesses you to be at. So you might think that you're young and healthy, but actually turns out that you might not be so much. I always like to use myself as an example. I was 33 when I first took this. My Rally age came out to be 53 because I am not a great eater. I don't drink enough water. I'm an overstressor. And so the nice part is it sets up then missions and goals that you can participate in to really try to get you to bring that number down. So hit the next slide, and you'll see how you take the health and wellness surveys. It's kind of a little example of what the questions will look like. Go ahead. And then the next slide, basically, after it gives you that Rally age, it sets up some sort of goals for you. Again, all the goals are picked by you. It's going to suggest some, but you can look at the whole list of goals to actually pick ones that you're interested in participating in. But after you participate in them and then you check off every day that you've met the goal, you earn coins that you can use to purchase some items inside the marketplace. But also the nice part is you're changing your habits. So one of the goals might be, let's say, don't skip meals. And then you go in every day and you check off when you're eating your meals that you're not skipping meals or that you're cooking more at home. So it's very interactive to kind of get you to build a new habit-based, performance in your life. And then the great part is after you're done taking the health and wellness assessment, the next year you can then take it again. So like now, it's been a year for me. I took the health and wellness assessment again. Now I'm 34 and I am only 47 now. So I am getting healthier by the day, people, by the day. So just so you know, that's how that works. The next slide will show you the marketplace. So the marketplace is where you can utilize your coins to actually buy things, buy discounted items, enter sweepstakes, buy gift cards, all kinds of stuff like that. And again, this is 100% free for you to use. It's available for you and your spouse for you to use. So just know you just have to be enrolled in United, and all of this stuff comes along with it. Okay, this is what the app's going to look like. So it's very fun, user-friendly. There's also a lot of community there. So if you're interested in joining a group that, of other people that are struggling with the same thing you're struggling with, you can join a community, and then you can, post stuff, kind of almost like Facebook, with the community, so you all can be on the journey at the same time. Also keep in mind, and I mentioned this in the last group, that one of your goals it might set up for you, if you happen to have a BMI of 23 or higher, is going to be our Real Appeal weight loss program. And after January 1st, we'll do a whole new session on Real Appeal, all about how you can qualify for that program, how it's free to you and your spouse, as long as you're enrolled in United, and all the kind of program details about how that works. So after we get through the holidays, and start off that new year right, then we'll do a lot of information about Real Appeal. So if it kind of guides you towards Real Appeal being something that you're eligible in, don't stress yourselves out now around the holidays about trying to join the program. We'll join after January 1st, and we'll get that kicked off on the right foot. So that's kind of it. That's it about Rally. So it's a great program for you guys to kind of to get your foot in there, get your foot interested about wellness, kind of start getting some goals and missions lined up, and really just start taking a bigger ownership in your health and wellness.
All right, so we're going to go ahead and open the lines again for any questions. So I will go ahead and unmute you all. So the line is open for you to ask any questions, and also you can put questions through the chat as well. All right, so we had a question that came through the chat, and it says that Dina mentioned ID cards. He said that we received them, but can we order duplicates for spouse and for adult kids who live away from home? Also, if a child gets married, can they stay on our plan until the age of 26?
Okay, so the answers are yes, you can order duplicate ID cards for dependents or for your spouse or anything like that. You can either do so by calling the 800 number on the back of that card, or by ordering it through the website, the myuhc.com website. So whatever's easier for you to do, yes, you can order as many cards as you need. And then also, just a side note, that your dependents' names will not be listed on the dental cards. So just know, a lot of people are panicking because there only is the employee's name. The dependents won't be listed on the dental cards. But yes, you absolutely can. Regarding the dependent issue, I believe that yes, the children are able to stay on the insurance up until the end of the calendar year in which they turn 26.
We have another question that says, I received a health and dental card. Is there a separate vision card, or is it included in the health card?
Sure. So we do not send out vision cards anymore. We're one of the carriers that's kind of fallen in line that do not send them out. So you'll be looked up by your social security number and the name of your company when you actually go and get your vision exam. But if you're a person like me that likes to have something in hand, you will be able to pull up a vision ID card on that Health for Me app. So when you log in, you finally have your app up and running, you can click at the top for ID cards, and it should pull up your medical, dental, and then a vision card. But really, it's just going to be your social security number that you're going to utilize at the vision provider.
All right, we have one other question. It says, when will we receive the HSA cards?
The HSA cards should also be sent out soon. I can check on the date that they were mailed to try to give you a little bit more of an answer on that. But everything should be received in hand before 1/1 is when you should get it. Again, it's going to be sent in a nondescript white envelope, so keep an eye out for it. But I will send an email and just check again and see when cards are targeted to be mailed.
That's all we have for now. So the line is still open for questions, and so is the chat. We'll leave it open a little bit longer in case any other questions come in. All right, so we don't have any other questions that have come through the chat, so we're going to go ahead and close out the webinar. Thank you all so much for listening in today and taking out time of your day to hear about our wellness programs. And again, if you have any questions, please feel free to email us at HR, or you can shoot me an email, Shira here in HR, or Ashley. We're here to help you all with any questions that you all may have. And again, thank you again for your time.
Thank you.
Thank you.
Thank you.
Thank you.